Of these, 3 were mild cases and 5 were severe. Currently, 5 patients are admitted, but Dr. Namutebi notes that more people with flu-like symptoms are not getting tested. The hospital has isolated the 5 patients in the medical ward, and if the numbers increase, they have a larger isolation ward very ready.
So we had five admissions. We discharged 1, 4 are still in the hospital and they're going treatment. It doesn't mean there are only 8 patients. Many people have flu and cough and such symptoms. Very few of them are coming to hospital to test. But the ones who felt very sick and came into hospital got tested, and those who are tested, only 8 turned positive.
Dr. Namutebi stresses that COVID-19 is not disappearing and urges the public to understand that it will coexist with us. She emphasizes the importance of revisiting standard operating measures and encourages people in the Kigezi region to get booster doses to mitigate the resurgence.
People are not washing their hands, yes, with sanitizer or soap and water. People are touching the wrong places. We want to implore the public, because especially the public in the Kigezi region, because of this surge in the cases, to remember the SOPs, to wear their masks when they're in public, to wash their hands with soap and water, to avoid congested places. And yes, it's time to go for the vaccines, for the booster, to prevent severe forms of the disease.
Besigensi Alfred, the Kabale district health educator, also acknowledges the resurgence, attributing it to a decline in public response to vaccinations as COVID-19 cases decreased.
A very, very good turn-up at the beginning. But later, when the perceived risk reduced, the turn-up reduced, and we are getting very, very few people who are coming for vaccination against COVID-19. The reason why we even had the vaccines getting expired.
He highlights that although 80% turned up for the first vaccination dose, less than 30% are getting booster doses, leading to vaccine expiration.
In cases of COVID-19 again, where we are getting cases every day, and even some cases being admitted at the hospital, we call upon the general public to come up and take up vaccination, because the main public health intervention that will be very helpful.